Hi, this is Ashley at Portland Wellness Care, and today I wanted to show a couple things about the knee. So just to start with a little bit of anatomy, in case you haven't seen what the inside of a knee looks like, here are some of the bones. So down below you can see the shin bone, which is called the tibia, and then tucked behind it, this is the fibula, another lower leg bone. On the top, we have the femur, which is your thigh bone, and then sitting right in front, this is the patella, which is the kneecap that you can feel right at the front of the knee, especially prominent when you kind of like bend and straighten your leg. You can feel that one as the most sticking out point. So you can see there's a number of attachments here, some tissues connecting the bones together. A lot of these are ligaments, and then some of them are tendons that flow into muscles. The muscles are not shown on this model, but you can see that there's a really big ligament, or sometimes called a tendon, because it connects ultimately to a muscle. This is the infrapatellar tendon right here below the knee. It crosses over the patella and becomes the suprapatellar tendon, which connects to your quadricep muscles. These are the really big thigh muscles you can feel in the front of your leg. In the back, you've got a couple more tendons. This one is the popliteus, and then below you've got some of these ligaments here that maybe you've heard of. There's the MCL and the PCL. So if we open the knee joint up, you can see on the inside, this is the meniscus here, these two circular patterns going around each of what are called the femoral condyles. So these are the articular surfaces, which just means where the joints are. So these are the surfaces of the joint that interact with each other, they articulate with each other. So common knee injuries. A very common one has to do with this patella and the tendons attached to the patella. So you can often experience, especially with kind of overuse injuries, people who run frequently, hike frequently, even just have really active jobs in their feet. Consider delivery workers or people who work in restaurants. It's very common to have irritation of the infra or even suprapatellar tendon. So this could be a tendinopathy. Sometimes there's just pain to do with how this patella bone, since it's kind of loose, how it kind of tracks or moves, slides over this femur and over these joints. So when there's pain with that, we sometimes call that patellofemoral pain syndrome. It's also known as runner's knee when you have problems with these tendons and the tracking of the patella. Other common injuries, especially with more like high impact, as if if somebody kind of tackled you from the side and hit your knee, or if you had a bad fall where you kind of twisted your ankle and fell over. Sometimes there can be injury to the ligaments on the sides of the knee, like this one, the LCL and the MCL. And then also with that kind of high impact trauma, you can get damage to the internal parts of the knee. So these meniscus joints, and then not shown, but very commonly injured, the ACL and PCL, which are ligaments deep inside of the knee joint. The general rule is that ligaments provide stability to the joint, usually more at the ends of the range of motion, and then muscles provide stability to joints kind of in the mid-range, so they control the movement itself. So basically you know that if you've damaged a ligament, your joint has been pushed to its very edge and then taken a little too far, so there's been some damage to those. I think you should cut here.